Ever feel uncomfortable discussing someone else's health? I do too, but sometimes personal stories reveal critical national issues. Let me share something surprising that connects one man's personal health journey to policies affecting millions of Americans. A distinguished medical expert who's served multiple administrations as FDA Commissioner, advised President Biden, and led prestigious medical schools recently analyzed President Trump's annual physical report. What he discovered was actually positive news worth sharing. According to this medical authority's analysis published in The Atlantic, Trump has made remarkable health improvements. During his first term, scans showed coronary artery plaque buildup, putting him at heart attack risk. In 2020, his BMI classified him as clinically obese. This combination would have made him an ideal candidate for modern weight loss medications. Fast forward to his most recent physical, Trump has shed 20 pounds, moving from obese to merely overweight. While speculation about weight loss drugs has circulated throughout his campaign, neither Trump nor the White House has confirmed this. When contacted for comment, officials simply stated the president is in peak physical and mental condition. The most revealing aspect of Trump's medical record isn't the weight loss, it's his medication list. He's taking what doctors call intensive lipid-lowering therapy, a treatment typically reserved for patients at significant cardiac risk. And impressively, it's working. His LDL cholesterol has plummeted dramatically. This presents a compelling success story against conditions that plague tens of millions of Americans: obesity and cardiac disease. Trump's health improvements stem directly from accessing excellent medical care and cutting-edge science. But here's where personal health intersects with national policy. While Trump benefits from America's medical infrastructure, his administration actively dismantles it for everyone else. Consider the National Institutes of Health, the very government research agency that develops science behind these life-changing medications. Trump has gutted its budget, canceling nearly $2 billion in research grants. Meanwhile, the FDA, which ensures these drugs reach markets safely, faces crippling staffing cuts. Remaining staff struggle with frozen government credit cards, preventing basic functions. Even more concerning, Trump and congressional allies are debating how many hundreds of billions to slash from Medicaid health insurance covering tens of millions of Americans. And those revolutionary weight loss medications potentially benefiting so many. Trump rescinded a proposal to have Medicare cover them, despite vague promises about securing price reductions through deals. The irony is striking. Trump's personal health improves thanks to scientific and medical infrastructure built over decades by the US government, while he simultaneously destroys that infrastructure for everyone else. The medical expert who analyzed Trump's health records has authored a new book releasing tomorrow, Diet, Drugs, and Dopamine: The New Science of Achieving a Healthy Weight. When interviewed about the president's medical report, he emphasized, "Weight is such a fraught subject with so much stigma attached, but it's not about weight, it's about health." He confirmed Trump's cardiac scan showed plaque buildup, leading doctors to prescribe 2 lipid-lowering drugs. What no one has mentioned about those drugs is they constitute intensive lipid-lowering therapy. And they're working. His lipids dropped dramatically from 143 to 51. That reduces heart attack risk and prolongs life. The crucial point: the science behind those drugs was developed through FDA-funded research and shepherded by the FDA. The president is destroying the very institutions that created medications benefiting him personally. Many might assume drug development happens exclusively through pharmaceutical companies. However, the government plays an essential role in identifying biological targets that medications work on. The expert explained, while drug companies synthesize compounds and conduct clinical trials, the identification of receptors came through Nobel Prize-winning work funded by NIH. No drug company has that capability alone. This parallels a previous situation when Trump contracted COVID during his first term. He received potentially life-saving monoclonal antibody treatment at Walter Reed, developed through government-funded research. Ironically, Trump later fired the very official who made that treatment possible. The expert revealed another alarming statistic: there are currently 6,700 recusals at FDA paperwork submitted when employees seek jobs elsewhere. An exodus of expertise is underway. During Operation Warp Speed, we relied heavily on that expertise. The Trump administration will need it too, but hasn't realized that yet. There will be moments when they turn around to find no one with necessary knowledge remains. This pattern of benefiting from government healthcare infrastructure while dismantling it should concern all Americans. It's not just about one person's health journey, it's about the future of medical innovation and healthcare access for millions. What do you think about this disconnect between personal benefit and public policy? Leave your thoughts in the comments below. And if you found this analysis valuable, please subscribe to our channel and share this video with friends who care about healthcare policy. Together, we can stay informed about crucial issues affecting our nation's well-being.